Stephanie Loraine is an LGBT Boricua?
Boricua.
Thank you. That was on my list to ask you before we started, and I apologize. She's a reproductive justice advocate and social worker, originally from Puerto Rico, and now living in Florida. She's an abortion storyteller with the We Testify initiative and leads the Hispanic Federation's reproductive justice program, Mujeres Empoderadas.
Very good.
I got a little left in me there. I can get it if I practice. Focusing on efforts to destigmatize abortion through policy advocacy, community education, and grassroots space building. She's a graduate of the University of Central Florida with a master's in social work. She serves as the vice president of the Central Florida Women's Emergency Fund. And on this very busy day for us all, she's taken time to be with us this afternoon. So please join me in welcoming Stephanie Loraine.
Hello, everyone. How are you? It's nice to see you all here today. I'm so glad to share space with you all. And like my friend here said, my name is Stephanie Loraine. I am a social worker living in the Central Florida area, and I've been involved with the Central Florida Women's Emergency Fund for 3 years now, so happy anniversary to me. So moving right into the presentation, I'm going to do a presentation, and then we're going to do like a breakout activity. And I'd want to ask you to work with your partner sitting next to you or whoever you're most comfortable doing that with. So a little bit about me. My pronouns are she and her. I am a secular humanist. I grew up with a complicated faith system in my household. And all four of us as children in my household ended up being non-religious. So that's really guided my work as a social worker and as a reproductive justice advocate. That's my experience as a social worker, doing direct care, providing counseling services to POL survivors, to working with people who are recently incarcerated. And then I transitioned into doing some advocacy through abortion storytelling and reproductive justice advocacy. And like I mentioned, I've been involved with the abortion fund since 2015. And that is my Twitter and my email address. If you'd like to reach out to me, I can post that again later. All right, so the Central Florida Women's Emergency Fund has been around since 1996, providing financial support to people in need of abortions in Central Florida. So we now serve about 300 people per year with support going directly to clinics in Central Florida that include independent clinics as well as Planned Parenthood. And that's our social media, so please follow us on social media as well. So why do abortion funds exist? Abortion funds exist to fill the gaps our government leaves by legislating pregnant bodies and creating laws and institutions that make abortion inaccessible. So progress was obviously Roe v. Wade, and abortion became the law of the land and you were able to access an abortion legally. However, ever since then, laws have been created to chip away at the ability to access an abortion. So within 3 years that Roe v. Wade was passed, we have the Hyde Amendment. And the Hyde Amendment it prevented federal money from going to abortion. So any federal dollars cannot pay for abortion. So when people talk about defunding Planned Parenthood and all of those things, federal money does not go to abortion, and it has not gone to abortion since 1976. Now, what do abortion funds do? They provide support in a few different ways. So there is financial support, there is practical support, and then there's advocacy. So the financial support, that's something that we do. So we provide financial support directly to the clinic to lift up people who are in financial need to be able to access their abortions. Then there's practical support. And abortion funds exist around the country and around the world to create and build access to abortion. These abortion funds also do practical support, which is the logistical support. Sometimes we need to travel out of state, sometimes even out of the country to build access to abortion. So that takes the logistical support of abortion funds who create those connections with other organizations and other abortion clinics throughout the country. And then there's also transportation assistance. So when you have to travel out of state, being able to afford a plane ticket may not always be the case, or in big states like Texas, where there's only 8 open clinics, those build that, fill that gap so people can take the bus or take the train or however to be able to get to the clinic. And then there's advocacy. So advocating against laws that restrict access to abortion and fighting for proactive legislation that protects clinic access and abortion as protected by the Constitution. So recently, and every year, there has been the FACE Act, which is a federal act that protects the clinic entrances. Every year in the Florida legislative session, there's an attempt to introduce this. And we have great advocates in this legislative session. Representative Amy Mercado and Senator Linda Stewart co-sponsored the bill to try and prevent clinic violence. And that's why the FACE Act exists. So things like that are things that abortion funds advocate for. So abortion funds are reproductive justice in action. So what is reproductive justice? You have some definitions right here of reproductive oppression and reproductive justice. So the reproductive oppression, that's the regulation of reproduction and the exploitation of people's bodies based on race, sexual orientation, sex, class, gender, sexuality, ability, age, and immigration status. And on a very basic level, that's what reproductive justice does. It's to build bridges to be able to access abortion despite the reproductive oppression that a lot of people experience. So the difference between reproductive health, rights, and justice, and they all build on each other, and they're dependent on each other. So reproductive health, that's the actual health that you receive when accessing reproductive health, so going to the clinic. Progressive healthcare clinics, they provide a full range of reproductive health that includes birth control, abortion, and in some clinics like Planned Parenthood, it has expanded to provide gender-confirming medication. Reproductive rights, so it's the legal advocacy model, fighting for the right to choose. And then reproductive justice is an organizing model based on intersectionality, based on the different structural inequities that we have that impact our lives and our ability to actually access abortion. So intersectionality, we do not lead single issue lives. So our ability to access quality reproductive health care is predicated by where we live, our socioeconomic status, our gender identity, our age, our race, and our immigration status. So going through this, different states enact laws to diminish the access to an abortion and to undermine the full spectrum of options. So that includes trap laws. Those are the laws that, they're really stupid, but they create small pieces that make it impossible to operate a clinic. So that is requiring clinics to be ambulatory care centers, even though we know very well that a less than significant percentage of people actually go into complications having an abortion. That is waiting periods. So across the country, different states have 24, 48, 72-hour waiting periods, even though we know that statistics show that once people decide that they want to have an abortion, they're going to go through with it, whether we allow them to or not. And then legitimizing crisis pregnancy centers, which is happening in the state of Florida and has happened already. They've been funded by our state legislature for 12 years, and they have been a line item in the state budget. What that means is that the state has legitimized these places that don't provide medical care. They lie to people seeking abortions, and they do not give them the full spectrum of options that exist. For them, they recommend places that only promote childbirth. They only provide referrals to people seeking childbirth. So that limits people's ability to actually go get reproductive health care, because if you walk into a crisis pregnancy center and you say, well, I want to have an abortion, that's what they do. They try to change abortion-minded people. So then we have age, so parental involvement laws. In many different states, we've also had, I think it's about 37 states, they have parental involvement laws. So that means that for minors, trying to seek abortion access before they turn 18, that means that they have to have their parents involved some way. There's parental notification laws, and then there's parental consent laws. In certain states, I think it's about 6 or 7 of them, it's actually parental consent. Now, parental notification, that's what we have in Florida. And parental notification means that they have a long, convoluted way of explaining it in the state law, but it means that a parent has to be notified within 24 to 48 hours of a minor having an abortion. But what does that really mean? That actually means that minor has to talk to their parents and let them know and bring them with them to the clinic to prove that they are the parent by showing some kind of birth certificate, showing proof that they are the parent. And then that minor is able to access an abortion. That's not always possible for a lot of people to do. That's something that I went through when I tried to access an abortion when I was 17, where I had to go through a judicial bypass process. And the judicial bypass is a workaround for these parental notification and involvement laws, where a judge decides your fate. A judge decides whether you're going to be able to access an abortion or not. And thankfully, I was able to get mine approved. But I was lucky to have a pro bono attorney take my case. I was lucky to have transportation to make it to the clinic. I was lucky to be working a job that allowed me to save up money to be able to get to the clinic. So we know that age is a huge thing that impacts the ability to access abortion. Immigration status. So the anti-immigrant climate right now, it decides for you that you're not going to build your family, because you can be ripped away from your family, you can be deported, and you can be taken away from the children that you've been forced to have in this country because of these laws that restrict immigration status. And then socioeconomic status, so access to health insurance that includes abortion care, not just prenatal care, and money to cover an abortion, birth control, or emergency contraceptive. So we know that the connection between economic justice and the ability to financially access an abortion is one of the hugest impacts of people actually being able to get an abortion. If you don't have money to get an abortion, if you don't have transportation, if you don't have all of these things that are tied into your socioeconomic status, you're not going to be able to get an abortion. So in Florida, this is a state of abortion. So this is the laws that currently impact the ability to access. So we have a 24-week limit on elective abortion. We have little to no clinics that provide care after that, and it requires people to travel out of state. Currently, there's I think only 5 clinics in the country that actually provide care after that limit. And after 26 to 27 weeks, there's only 2 states in the country, New Mexico and Colorado, where you're actually able to have an abortion, an elective abortion. So an abortion that you choose, not because of the health of the pregnant person or rape or incest. The parental notification that we spoke about, state funds the crisis pregnancy centers. The state Medicaid does not cover abortion under the documented incest, sexual assault, or life endangerment of the mother or fetus, and then mandatory ultrasound before obtaining the abortion. And the abortion provider actually has to give you the option to view the ultrasound before they continue. Now, how can you become a reproductive justice ally? And that's why we're here today, to build bridges between these movements, right? So when we're talking about economic justice, the fight for 15, the fair wages, employment discrimination, and you cannot access your choice because the pregnancy is decided for you, you don't have money, and like I mentioned up here, the hypocrisy of eliminating social reforms that allow for the equitable survival of people of low income. So if you don't have access to an abortion and then the state forces you because you don't have money to afford it, you can't get to a clinic, then they eliminate CHIP. Then they eliminate all the things that keep you surviving. Then we have environmental justice. So air and water quality, especially in low-income communities, they impact pregnancies and they impact parents and families. Immigrant justice, so right now, fighting for DACA, TPS, and the elimination of local law enforcement cooperation with federal immigration enforcement. So right now, like the Orange County Jail works with ICE and Border Patrol to have detainer holds on folks who have been arrested, even if it's something minor, like a driving without a license or all of those things, and they wait for federal immigration enforcement to come pick them up. Racial justice, so the movement for Black Lives Matter, advocating for injustices that are impacted by race, like police brutality. So the hypocrisy of, I know we all have seen these billboards, right? So the billboards that say, they'll have Black and brown children on them saying, "Don't kill me," or whatever type of stigmatizing message they want to use. But as soon as that child is born, they are subject to police brutality. They are subject to dying because they don't have access to health care or what they need to survive. And religious reform. So religion doesn't belong in politics. We all know that. It should not inform lawmaking. So religion, as we know, impacts a lot of the legislation that passes. A few days ago, I was in Tallahassee listening to a hearing about CPCs and including them permanently in the state budget as a funded entity. And the elected official started off by saying that pregnancy is a gift from God. So these are the things that affect our laws. These are the things that impact the way that people are actually legislating when it comes to legislating our bodies. So should not be happening. And how can you support abortion access in Central Florida? So I'm not sure if anybody has escorted patients before, but patient escorts are a huge piece of reproductive justice access. So clinic escorts are typically outside of abortion clinics or reproductive health clinics, and they escort patients from their car to the clinic for their appointment. And this is necessary because, as many of you have seen, in front of clinics, there's protesters. Protesters screaming at you, telling you all types of ridiculous things to get you to change your mind or to scare you out of getting the health care that you need. So that's why clinic escorts are super important. And Planned Parenthood currently has a very big escort program in their at their clinics for days that they are providing abortions at the clinics. So fight abortion stigma. I make it a point to, if we're talking about reproductive rights, obviously I talk about abortion, but abortion impacts so many different pieces of our lives, and I think it's important to normalize it, to talk about it. So I remind people that everybody loves someone who's had an abortion, like my t-shirt says. Share your abortion story. So these laws dehumanize people who need an abortion and the people who have had abortions. So we have to remind our lawmakers and anti-choicers about the people that the bad legislation and these stigmatizing messages impact. So these impact everyday people. We just don't know who it is that has had an abortion around you. And it is those anti-choice protesters. A lot of them have had abortions. So I'll go into a piece. I spoke at the Women's March Convention in Detroit in October this past year. And we did a panel, me and some fellow abortion storytellers, we did a panel about storytelling for the revolution and how abortion storytelling impacts the stigma and culture of stigma around abortion. And we actually had people from this group called And Then There Were None. And they're a group of anti-choice people who harass clinic workers and try to get them to quit their jobs, try and get them to expose the clinic, try and get them to do all these ridiculous things, playing on the fact that people can feel confused or feel conflicted about the work that they do, and playing on stigma, on what has to do with abortion stigma. So they showed up and they took over our Q&A session, asking questions about, did you regret your abortion? And what about reproductive coercion? And all of these super loaded questions, even asking questions about fetal tissue, like all these things that people use to stigmatize people who have had abortions. And our continuous answer will always be that we support people and there's the full spectrum of their decision making when it comes to their bodies, and especially when it comes to abortion. So whatever you feel like you want to do, if that includes abortion, if that includes adoption, if that includes whatever it is your choice, that's what we're here to support. And that's what these anti-choice protesters do. So they stalk you, they stalk clinics, they stalk people who are activists. So just so that you guys know about that. Follow reproductive justice organizations on social media for action alerts and ways to fight back against anti-choice legislation and support proactive legislation. And then obviously donate to the abortion fund, donate to the Central Florida Women's Emergency Fund at our website. And if you aren't from Central Florida, there are abortion funds around the country and in several other countries outside of the United States, like Mexico and in the UK, that also build access for abortion. So we're going to do our breakout activity. So this activity is going to be about a pregnant person's journey in Florida, remembering the state of abortion in Florida. So the laws that impact the ability for someone to access an abortion in Florida. So a reminder, these are the laws, these are the restrictions that currently exist. And I'll pass out some forms. There's going to be 4 different stories on there. And I want you just to focus on one, whichever one you feel calls to you or is something that you'd like to explore. And work with 1 or 2 people around you just to think about this person's life. Think about how these laws can impact their actual choice in being able to access an abortion. And then we'll come back in a few minutes. So I want to go around the room and I want to hear some thoughts and reactions about some of the scenarios. So does anybody have any thoughts on a scenario that they chose to talk about with their group?
Do I have a hand up?
We picked scenario number 2, the undocumented mother. And the thing that we're, I guess, concerned with is if a person, even if they received the financial funding, would they somehow would the name remain anonymous? Or would they also be in fear of being somehow reported and the fact that they're undocumented show up?
So undocumented people live in fear no matter where they access healthcare or go to the dentist or go to the grocery store. They live in fear. So we hope that at this clinic, if there is a person who is showing their passport versus showing their Florida driver's license, that the clinic worker doesn't decide to call immigration on them. But it is a valid fear that people consistently live with. And there's no, despite the government wanting to create databases of people who have abortions, thankfully that's not the case. So there's no sort of tracking system. So they do have to give their name to provide consent. They have to provide their legal name. They have to show that they're over 18. All the basic processes, just like receiving any other healthcare process. Any other questions or any other thoughts and feelings about the scenarios that came up for you?
On that one, do
Yeah.
you have to? Along those same lines.
Yeah.
Do you have to show any not identification, but are there any questions that come up regarding your status, and we were all talking about the case, when was it, like last year, the 2 undocumented people, and so did that just happen to come out, or is that something that really could come out if you seek assistance?
So, like I mentioned before, so anybody who is undocumented seeking any kind of service puts themselves out there and puts themselves at risk for somebody reporting them to immigration, right? In the case of accessing an abortion, that's not something where you're reporting anything to anybody. The reason you have to show identification is really for the age restrictions, and to make sure that you are who you say you are and who you're to access the abortion. Now, in the case of the Jane Does, I did a story last year with Rewire talking about these cases, and what was different about these particular cases is that these Jane Does, these undocumented folks, they were in immigration detention, and they were minors. So they had both of those things going against them in trying to access this abortion, right? So they went through the judicial bypass process. So they were able to get permission to kind of become like a ward of the state to allow them to get the abortion. They got the waiver, the judicial bypass waiver that the judge approved for that person to make the decision, that they were capable of making the decision without parental involvement or guardian involvement. But what happened? There's a tagline that was being used, is that this young person was being held hostage by Immigration and Customs Enforcement and by ORR, the Office of Refugee Settlement, and that's where minors were being held, who are about, I think she was in deportation proceedings. So that's where it got really complicated, because here we have a minor who is in federal custody trying to access an abortion, even after the state said that you can legally get an abortion without your parents' permission. And they used a few tactics to prevent her from being able to do so. They provided her religious counseling. They sent her to a CPC, a crisis pregnancy center, places that promote childbirth. They prolonged the process of her being able to actually get an abortion, so that she would have to do it outside of the state of Texas. So using that person's immigration status, using that young person's immigration status against them, that's how they were able to prevent this person, or try to prevent this person from getting an abortion, until finally they were able to get their abortion. Weeks after the judicial bypass was actually approved.
The crisis pregnancy centers are fake clinics, we all know that, but
Yep.
but it is not typical of the regular clinics to out any patient. Is that true?
That is true.
Thank you.
Yep, clinics don't out people.
And by out, you mean is there immigration status?
Correct.
Okay.
Yep, expose anything that would be personal about that person. Just like any other healthcare provider, people accessing abortion are protected by HIPAA, and that's the federal privacy laws. So those kinds of things aren't exposed. Any other things or thoughts or feelings that came up when reading these scenarios?
I was just going to piggyback along with the second one. Well, if she's working, she's got 3 kids, she's going to have to get a babysitter for 3 kids to go to, different appointments, and so that could be a hardship.
Definitely. Yep. The majority of people who have abortions already have 1 child, and that's a big reason why people choose to have an abortion, because they don't want to have another child, or they want to build the family the way that they want to, when they want to. So childcare is a huge piece of why people can't go to the clinic. They have to take the day off from work. They have to find somebody to watch their other kids. They have to get a ride to the clinic by someone who's a licensed driver. So that's definitely a huge barrier to be able to get an abortion.
And we actually were looking at scenario 1
Mhm.
with Sasha, and just recognizing just how many different barriers there were for her accessing an abortion. One of the things that we talked about was that in order for her to receive, she has no, doesn't work, doesn't have any money. So in order for her to receive an abortion through Medicaid, she would have to report her assault, and then prove that an assault happened, which are two different things, right? So it's like you experiencing that trauma, reliving it by telling someone and having everyone know that legally, and then also people believing you,
right?
And so
with that, because based on the Florida state laws, by then 24 weeks may have passed because she doesn't know how many weeks she is already. But then the parental notification also takes effect. So it's like a contradictory issue right here. So she's required to have her family know, but if the parent is the one that is the assault, of her, so then it would mean that she would have to have that person incriminated, then do the bypass or become a ward of the state, and then to be able to access the abortion on her own. And with the way the Florida state laws goes in the court, that could be months and months, and this person will be forced to have this child.
Right, and actually, I was reading the legislation today regarding judicial bypass. And I was curious because I had a judicial bypass when I was 17, and I knew it existed. I knew I went through the process, right? But I didn't know the actual legislation behind it that said that within, it was all 3 days. Within 3 days of the attorney putting notice, you'll be able to hear back about getting a court date with the judge. Within 3 days, you'll get a response from that. But my process took 3 weeks. And that was the reality. From the time that I reached out to a pro bono attorney to the day that I was actually able to get my abortion, it took 3 weeks. So thankfully, I wasn't that far along that 3 weeks didn't impact my actual ability to access an abortion because of the 24 week time frame. But a lot of people aren't in that situation, and it is a time crunch because it is very rare for people to know within the first few weeks that they are actually pregnant, and a lot of people don't find out they're pregnant until they're at least 8 weeks along, that's where you miss 2 menstrual periods. So so let's go through each scenario. So I'm gonna give first, before I go there, a lot of the things that people were talking about that they commented over about these specific scenarios were barriers to access. And when we're talking about reproductive oppression, that's what we're talking about. That's what we're talking about, our lives not being single issue, because we have all of these layers that affect your existence, that affect your ability to actually access the abortion. So the immigration status, the age, and sometimes your gender identity, your class, your socioeconomic status, all of these different pieces. And those are in real life, in real time, how those things impact you. So that's why these stories are so diverse. There are people's lives. And that's why it's important to remember reproductive oppression when thinking about these things. So, state of Florida. So if we go into with Sasha is a victim of sexual assault. She's under 18 years old. There's some domestic violence in the home. Doesn't know that they're pregnant yet, but gonna find out. And they're not working right now. So, what do we think happened to Sasha? Was Sasha able to get the abortion she needed if she wanted one? Think so?
Yeah.
Yeah? Think so?
Judicial bypass.
Yeah. So Sasha's story is similar to my story, and I was able to get a judicial bypass. I didn't get funded through an abortion fund because I didn't know abortion funds existed at that time. But if we were to have a case with a minor who reaches out to us, that's something that we handle delicately, and we handle through the clinic as well. But we don't discriminate on who we provide abortion access care to. But this person was able to get funding from an abortion fund because they couldn't afford to get an abortion. This person had to get a judicial bypass to the state of Florida because there's domestic violence in the home. According to the statute involving judicial bypass, the state has the burden of proof. The state has the burden to prove that the person is capable of making this decision on their own. That person carries the bigger burden of proof, which is you have to prove that you are in significant danger, that your life is in significant danger if you were to tell your parents that you were having an abortion, right? So that's why I mentioned the domestic violence in the home, because that's a clear-cut situation, especially if it's been reported, that somebody would be able to give record of, which is something that I had to do, was give record of the 911 calls that were made from my home, give record of when things happened and the police were called. So that's a huge piece, and that's a big reason as to why I was actually able to get a judicial bypass, because in the statute, it says it cannot take in the consideration to the decision cannot take into consideration that person's socioeconomic status or the impact that potential fetus would have on that person's life.
How did you learn that there was such a thing as a judicial bypass if you were, how old were you?
17.
17. How did you know that?
So the internet was definitely around at that point. So I'm only 26 or 25. I turn 26 next week. So I was 17. So we do the math. Wasn't that long ago. Yeah, Google. That's what I did. I Googled. I Googled abortion. I Googled what can you do to not tell your parents that you're having an abortion. And I found a hotline to call, and that's how I was able to go through and find a pro bono attorney who was able to take my case and go through that process. But not everybody has access to the internet, and that's when we're going into we're thinking about the socioeconomic impact of being able to access an abortion. And I mean, I had a job. I was working as a waitress. I bought my own car. I had little pieces that made me more independent, that gave me the ability to be able to go and get that abortion and prove to the judge that I was capable of making that decision. But unfortunately, not everybody can do that. Not everybody has the ability, both cognitive and just in general. They're not able to have the ability to say like, oh, this is the process, or know the process, because it's a convoluted process and it's created that way to make it complicated so people give up. So Sasha was able to have an abortion.
I have a question about the statistics. How many?
Here you go.
Oh, I have a question about the statistics. How many girls under the age of 18 have an abortion compared to how many could potentially in this situation needing parental consent?
I don't know. I don't know that number.
That would depend on the state or country that you lived in.
Yeah, it definitely depends on the state, because different states have different laws about parental consent. Like I said, there's no tracking system of minors who have had abortion. Okay. State laws require records to be held of the judicial bypass process, just like any other court proceeding, but it's not accessible to the public. So I don't know of those numbers of people who are minors accessing abortion, actually. But minors or young people are the people who most are impacted by accessing abortion because of their socioeconomic status and their lack of independence because of their age.
Are you ready for questions, or do you want to wait?
No, I'm gonna go through, so it'll just be like going through as we go through the scenarios. Please feel free to ask questions as they come up. There's no issues with that, but we'll be going through all the other scenarios.
We had a thought.
I'll be right there.
We had a thought on scenario one with Sasha when it says she doesn't know she's pregnant. So how far along did you get? Because you might have been running up against the 24-week limit.
Yeah, so I was actually only 2.5 weeks pregnant. And I was a little more astute with my body because the year before I had gotten pregnant. I knew what the symptoms were. I knew what the feelings were. And actually, and I'll provide a link later to my abortion story, where at the time, the state law didn't allow for minors to purchase emergency contraception without a prescription. So my partner at the time tried to purchase it for me, but the pharmacist wouldn't let him. So I literally waited to get pregnant because I knew like you have sex and the condom broke. That's just the reality of what happened. So by the time I got an ultrasound, which was a requirement as part of getting the judicial bypass, I had to get an ultrasound and bring it to the judge. I was only 2.5 weeks along. But a lot of young people, because there's no comprehensive sex ed, they don't know their bodies and they don't have the ability or the money to go to a pharmacy or a ride to the pharmacy to pay the $10 that it takes to pee on a stick and figure out if they're pregnant or not. So yeah, good question. So moving into Mariana, we talked a lot about immigration status and its impact on the ability to have an abortion. And Mariana's story is different because Mariana, she took things into her own hands. And she's 35 years old, mother of 3, undocumented, working under the table, has no savings, 18 weeks along, right? So Mariana had an at-home abortion. Abortions have existed for as long as people have been able to get pregnant, so since the beginning of time, right? So there's many ways that people can have abortions not stimulated by conventional medication. And that's a reality for people all across the world. So this particular person living in the States had a at-home abortion that was incomplete. And they needed to go to the emergency room to be taken care of and finish because unfortunately those things can cause infections. And had she potentially been living in a different country, specifically when we're talking about Latin America and in countries where abortion is legal for any reason, like the Dominican Republic, you can be arrested and jailed. There is a woman in El Salvador who was in prison for murder because she was having a miscarriage. And she was about 9 months along, had a miscarriage. And she's incarcerated right now because she was accused of having an abortion. So, all right, so moving into the next scenario, we have Kelsey. Go ahead.
Not to mention now the hospital bill, the hospital bill of her, the half pregnancy is humongous, and we as taxpayers are paying for that. So might as well have the process available beforehand, right?
Yeah, absolutely. Thanks for mentioning that, Gertie. Because those hospital bills, after you go to the ER, just as a person who has insurance, are super real. As a person who doesn't have any money already, those are even worse. So Kelsey. Kelsey is a high school student, high achieving, cheerleader, helicopter parents, which means the parents are super involved. Found out she's pregnant yesterday. What do we think happened to Kelsey?
She got an abortion.
You think so?
Yes.
Anybody else?
I think she did.
You think so?
She adopted.
Potentially, right?
It could go either way.
Kelsey was able to get money for an abortion from her parents because her parents were well off. But her parents didn't want her to have an abortion.
Ah.
For religious reasons. They didn't believe in abortion.
That's what I thought.
And she continued her pregnancy and was able to receive assistance from her parents. And that is a reality that a lot of young people go through, where they are supported by parents, and there's nothing wrong with being a young parent. It's when you're forced into parenthood that becomes the problem. And it's important to normalize young parenting, and we should make it accessible for people to be able to live their lives on their own terms, and that includes being a young parent if that's your decision. All right, so the last scenario that we have here is Alex and Mel. Alex and Mel are a lesbian couple, pregnant through IVF, and 7 months pregnant, and just found out about a fetal anomaly. So what do we think happened to Alex and Mel?
They went out of state.
Anomaly is.
Yeah.
Yeah, we were wondering if it was gonna affect the safety of the pregnant woman.
Well, what about partial birth abortion?
Yeah, they could pay for IVF, they could hop a jet
Yeah.
over to New Mexico or Colorado.
Yeah, they flew to another state, I bet.
Yeah.
Yep.
Yeah, or if the doctor would give permission locally, like we didn't
So-
know what.
So the state of Florida is a little finicky because, like we mentioned, it allows if for the health of the person or the health of the fetus to have an abortion legally. But remember, just because something is legal doesn't mean it's accessible, right? So there are no doctors in the state of Florida that are going to provide an abortion that far along, electively. So this person had to travel out of state, and they had the money to have IVF, obviously, so they have the money to be able to travel out of state, but they still had to take off of work. They still had to potentially take medical leave. They had to, all of the pieces that go along with having a late-term abortion and traveling out of state, and the trauma that it is to have to leave your state, have to leave what you're comfortable with new people to be able to access the care that you need. And that shouldn't be the case. You shouldn't have to travel out of state to get the care that you need. So, you have a question?
I just want to play devil's advocate for a moment. Not my personal opinion. How do you answer to people, usually of faith, that say, why do we need access to abortion when you could put your child up for adoption?
Okay. So, as a person who supports abortion, I support the full spectrum of options for somebody, whether that means abortion, whether that means adoption, whether that means whatever that means for that person. But putting someone in for adoption is a personal decision, and for some people it's a very difficult decision. The foster care system as it exists already is overwhelmed by children who potentially come from parents that were forced into motherhood. So I definitely don't debate with religious folks because that's, talking to a wall. But that's where I answer in a way of, I don't talk about religion. It's not about religion. It's not about the science of whatever it is that you think. It's about that person's ability to access the choice, to access their own decisions, just as if they were going to get a root canal, or just like as they were able to get any other medical procedure. And that's where that's it. That's moot point, because it's about accessing your choice.
And also in this country, unfortunately, pregnancy isn't as safe as it is in other Western countries.
No, it's
Pregnancy
not.
and childbirth.
No, it's not.
And
And
having to carry it for 9 months to even get to the adoption.
right, and for people who are of low income who don't have access to medical care, let alone prenatal care, and then being forced into parenthood or motherhood, when you already don't have consistent access to medical care, makes that pregnancy, makes that potential child growing up, that makes that even more difficult on the person. Vivian?
I have an answer for that because my roommate actually adopted, and when she went to the adoption with her husband, they actually had bought an expensive dress for the potential baby because it was a black baby. And when they asked why they dressed her like that, because none of the other babies were dressed like that, the nurses told them that it was so that somebody would pick her. So the answer is that when it's a baby of color, nobody wants them.
Yeah.
So why make a young woman be forced to have a baby that the system doesn't even care about to begin with?
Yeah. And when we think about the infant mortality rates and the maternal mortality rates for Black women are as bad, if not worse, than what they consider third world countries. And for us to be coming from the United States, that's awful. That's what people are sentenced to, because their ability to access an abortion is diminished by their race or their socioeconomic status. So now we'll open it up to questions. So whoever has any burning questions, anything that you want to know about the abortion fund, about this, about whatever.
So the abortion fund, does it spend any time or funding on promoting birth control?
Because see, I would love for this to be a non-issue, right?
Mhm.
And stop it at birth control.
Mhm.
You know, so just curious. Thank you.
So definitely in our advocacy, we definitely promote any the full spectrum of options to reproductive health care. That includes emergency contraception, that includes birth control, that includes abortion. Now, we don't provide funding for birth control, and that's not what we specifically do. There are some abortion funds around the country that have birth control scholarships. That provide really low cost emergency contraception or free contraception, emergency contraception if they qualify. That's just not something that we specifically do. And really this abortion fund has always been a financial support abortion fund where the money goes directly to the clinic and the clinic disperses it based on eligibility, based on financial status, how much money that person is able to get towards their abortion. And somebody asked me earlier what the cost of an abortion is these days. And if I'm not mistaken, Julia, between like $500 to $700, depending on up until 16 weeks, right? And then after 16 weeks, it goes up significantly. And up to like somebody like at the end where they're 28 weeks along, that could be $10,000. And there are national funds like the National Abortion Federation that has member abortion clinics that are both independent providers and like Planned Parenthood providers, where they can get some funding from the case managers. But it's not necessarily all of it. And definitely the burden falls on the person to figure out to either navigate the systems that exist or contact abortion funds to help navigate it for them.
I have a question similar to the one that was asked the first time. What does it cost for long-term birth control, subdural birth control like Norplan or the modern equivalent, number one? And number two, what's the difference between your organization and Planned Parenthood?
So I'll start with the second question. So our abortion fund works with Planned Parenthood to also provide financial support to people seeking abortions. Just like we also provide support to other independent clinics that are not part of the Planned Parenthood network who provide abortions. And the majority of abortion providers around the country are actually independent providers and not Planned Parenthood. And Planned Parenthood is actually not in the business of providing abortions that are in the second or third trimester. One, they're very costly. And two, that's just not what they're in the business to do. Now, as far as birth control costs range. We know that the ACA requires there to be some costs covered and associated with birth control. That's not always the case. I have an IUD, which cost about $1,000 from putting it in, having the appointment to manage that. But that was my choice to be able to have an IUD, and it was actually covered by my insurance other than the copayment. Pills can range from $20 a pack to $100 a pack. It all depends on what the person's needs are. Everything, the list goes on and on about the different options. Yep.
Something else about the cost of abortion in the UK, it's covered under the NHS.
They can't hear you back there.
About the cost of abortions in the UK, it's covered under the NHS. It's free.
Yeah.
So I have a question about the cost of abortion. Is there anything other than medical science and best practices that are escalating that cost? Of course, the cost of healthcare in general is sometimes inappropriate, especially for those of us who don't know much about it. But are there unnecessary things that are regulated by state government that make that cost more than it should?
Yes. So when we're talking about TRAP laws and those laws that make that force abortion clinics to meet unreasonable standards that other clinics or other healthcare providers aren't, those costs are put on the clinic, and those end up making accessing care more expensive. There's also between having to refit a clinic to make it an ambulatory care center, having to open the doorways to make them like so that a gurney could allegedly go through it. The cost of different doctors having to register with hospitals if they're allowed to be able to go to the hospital if needed. Security so that patients are safe. All of those costs fall on the patient, and they impact the cost of actually being able to get an abortion.
Do you have specific names of some of these crisis pregnancy centers? I've just never heard of them, and I want to be able to watch out for specific like local names.
Okay, so the way that you know if it's a crisis pregnancy center, outside they have signs that say free pregnancy tests. They'll say, yeah, that's how they get people in. Remember,
There's one up the road from me called Choices.
It's not Choices.
No choices.
Yeah, there's no choices there. So those crisis pregnancy centers, that's how they lure people in, using their socioeconomic status against them. They have also free ultrasounds. And it's super tempting because like ultrasounds are expensive. And then the fact that like if you're abortion minded and you are on Medicaid or you don't, like as a person or in Florida where we don't have Medicaid expansion, right? It does, if as a pregnant person, that's the only way that you can get Medicaid. So once you finally get Medicaid, trying to go to a Medicaid provider, to a doctor that provides prenatal care and telling them, hey, I want to have an abortion. Can I have a ultrasound so that I can know? And then no. So they use those kinds of circumstances against people. So they say things like abortion minded. They say things like reproductive coercion. They say things like free pregnancy tests and free ultrasounds and diapers for your baby and we'll take care of you if you continue, all of those things. So that's the big piece. And the websites are pretty clear, and they sometimes put information about abortion, but for the most part they don't. If you check out their websites, they don't have anything about abortion. They don't give true choice counseling. So you can also always call, say like, hey, do you guys provide abortions? Are you guys a center? And then they'll say, come in and talk. Yeah, well, let's come in and talk. Come in and talk to me.
If they'll say yes, the answer is no.
Yeah, obviously. So they use a lot of lies and deception to trick people into going there. So.
Yeah, I was going to say, I've seen some that have abortion pill reversals on their websites that are not like FDA approved.
Yeah, not medically accurate.
Real.
Yeah.
Like I don't think those exist. And I'll say that we're creating right now at Planned Parenthood, we're creating like a map to see where the independent abortion providers are, where Planned Parenthood centers are, and then where CPCs are. And CPCs are overwhelmingly in rural communities. Oh yeah. Overwhelmingly just like across Florida. Yeah. So it's a real scary reality.
So has anybody heard of Chiefland? Yes. Chiefland, population of about 2,500. There is a crisis pregnancy center there in Chiefland, Florida, that has 2,500 people. So that's what they do. They go into communities that don't have reproductive health care or that have a propensity of people of color, because that's their target. Their target is people of color and to prevent the alleged extermination of Black and brown babies.
So what can we do other than throw money at you today?
Oh my God, throw all the money at me. So support people who want to have abortions. Support people who tell you that they've have had abortions. CPCs, there is a huge CPC campaign to expose them. What I started doing was calling them and actually reporting them on social media or commenting on their social media saying this is not a real healthcare clinic. They do not provide abortions. Do not go here. Things like that. I started calling the 211 referral services. And for under abortion, CPCs are listed. So calling 211 to remove them, that's a struggle. But, if somebody knows anybody at 211, I'd like to talk to them. Supporting, I mean, other than supporting this abortion fund, there's abortion funds, like I said, around the country that do this work. There's other organizations that are reproductive justice focused, like Planned Parenthood, supporting Planned Parenthood's efforts to destigmatize abortion and provide healthcare access. So those are a few different ways that you can.
And the other thing you can do is tell all of your like-minded friends about our fund. It's just getting the word out there that our fund does exist, and donations are welcome. Because a lot of the people, Orlando, is, well, it's kind of blue, central Orlando is, but a lot of people are not aware that our fund does exist. And if they knew about us, they'd be happy to give money, because we're pretty low-key, we don't go advertise. But
right.
Yeah, tell your friends and neighbors, give money.
Yeah. Any other questions that anybody has before we close?
One more.
I know in the past that women could go to OB/GYN doctors for abortion. Is that still the case, or is there hurdles to that?
Really, it depends on the training that the OB/GYN receives. Actually, in a lot of medical schools, it's not required to learn how to perform an abortion. But there are like student organizations, like nursing students and medical students for choice. And they learn between them how to provide abortions. But unfortunately, because of the stigma associated with abortion or performing abortions, a lot of doctors don't perform abortions in their primary care setting, even though it absolutely is possible and plausible to provide that in the primary care setting. And there's actually an organization called Reproductive Health Access Project, RHAP. They're based in New York, but part of what they do is they train doctors to be able to perform abortions, and they train them on how to be able to provide abortions within the primary care setting. So different, very specific, and obviously in New York and not in the South. But it's definitely starting with medical students to try and get them engaged in reproductive health care.
Okay, one last question here,
Yep.
and then I think we're good.
All right.
My understanding is that some hospitals will actually perform an abortion if there's an issue with the fetus.
Yes.
Some won't, though.
Yes.
And is there an easy to find list so that if women are having difficulty in their pregnancy, which hospital to go to and which ones to avoid?
When it comes to
tell the ambulance driver, right?
right. When trying to access a reproductive health care, I would not go to a hospital that is a religious hospital, like a Catholic hospital, things like that. Any religious hospitals, that's when that situation becomes a little more complicated. Right?
Florida hospital.
Yeah.
You know,
Yeah, I mean that's what they do. They capitalize on those things. But that's why ORMC is there. So
Also, in choosing your OB/GYN, it's interesting to ask where do they get their training, because there are some Christian OB/GYN postgrad courses, and they do not cover how to do an abortion in the training, and in these OB/GYNs they're graduating.
yeah, that's definitely something that's being talked about on a national level, talking about what does my doctor support my decision if I do, like if you at the beginning of your pregnancy everything's okay, but then all of a sudden things are not so okay. And I mean that really takes a one-on-one situation of like getting to know your OB/GYN and asking those questions, like if I want to have an abortion, are you going to support my decision? Can you perform it? And it falls on the person who's trying to get health care, and unfortunately there's
if my understanding is right, most medical schools don't actually require training and have to perform an abortion.
Nope.
I think
They don't.
that should be a requirement, but in the atmosphere we have today, some doctors would probably say, well, that's against my religious principles to even learn how to do it.
Right.
Dummies, and visual aids.
Right, and that's what they do. That's what they do. Just like religion is used to justify so many other things, like discrimination. They use that to not learn about that care, and it's not required. And it's because it's so highly stigmatized. Even though it is a normal medical procedure that can be provided in an outpatient primary care setting, it is stigmatized, and that's why it's important to talk about abortion, to destigmatize it, and to demystify abortion, because that's why we have even medical professionals, and that's where the religious beliefs intercede.
It's like studying to be a mechanic and not being required to know how to change spark plugs.
Yeah, I don't do spark plugs. I don't do spark plugs. So.
Well, that's a great note to end on.
Yes.
Thank you so much, Stephanie. Great
Yep.
job.
Thank you.